Hello and thank you for taking the time to listen to my research presentation. My name is John Wu and I am currently a senior at Portola High School. Today I'll be speaking on a research project that I conducted that was based on data analysis. My research is titled as Increase in Multiple Myeloma Medication Adverse Event Reports During the COVID-19 Pandemic, an Analytical Investigation. This project delves into the impact of the pandemic on clinical care, specifically for multiple myeloma treatments. However, the methodology used in my research can be applied to any clinical specialty. For this research, I specifically focused on multiple myeloma, the second most common hematologic malignancy. Multiple myeloma is a cancer of the antibody-producing white blood cells called plasma cells of the immune system. Because the cancer causes the body to go into overdrive to produce unnecessary antibodies, the disease is characterized by anemia, weakness, bone lesions, kidney failure, and immunodeficiency. As seen in the figure, patients can often develop bone lesions in the skull. These are severe enough to appear on regular X-ray. The treatment strategy for multiple myeloma involves initial oral and intravenous chemotherapy to bring the cancer under control. Once this has been accomplished, the patient receives an autologous stem cell transplant in which the patient's own bone marrow is isolated and cancer cells are removed and healthy bone marrow is returned to the patient to replenish the immune system. Autologous stem cell transplant requires lengthy hospitalization. Multiple myeloma and other cancers not only present a physical and emotional challenge for patients and their families, but also a financial challenge, unfortunately. The United States is behind other countries with regard to provision for economical, affordable, and universal healthcare. Many individuals are unable to bear the cost of medical care and medications, and a cancer diagnosis in particular can mean bankruptcy for some families. My research study had two main objectives. My first goal was to analyze adverse event reports for multiple myeloma chemotherapeutics in the pre-pandemic and post-pandemic eras in order to determine whether there was any correlation between adverse event reports and the onset of the pandemic. I used data from the Food and Drug Administration Adverse Event Reporting System. My second goal was to analyze trends in the prices of multiple myeloma chemotherapeutics. I used data from the Congressional Budget Office and specifically the Centers for Medicare and Medicaid Services Medicare Part D prescriber database. My analysis included 9 FDA-approved medications used to treat multiple myeloma. The analysis encompassed 6 small molecule pharmaceuticals, dexamethasone, as well as lenalidomide, pomalidomide, bortezomib, carfilzomib, and ixazomib. The analysis also encompassed 3 biologic drugs, daratumumab, pembrolizumab, and rituximab. The chemical structures of the 6 small molecule pharmaceuticals under investigation are shown here. Dexamethasone and lenalidomide are both considered first-line treatments for multiple myeloma. Pomalidomide is a drug in the same class as lenalidomide as shown by the similarity of the chemical structures. Bortezomib, carfilzomib, and ixazomib are often administered when the patient's multiple myeloma has not responded adequately to dexamethasone, lenalidomide, or pomalidomide. Some of the small molecule medications in this study, such as dexamethasone, have been in clinical use for decades. Others, such as bortezomib, carfilzomib, and ixazomib, are much newer. Biologic medicines are the newest approach for treating multiple myeloma. The macromolecular structures of the 3 biologic drugs under investigation are shown here. These drugs are all monoclonal antibodies that are directed toward cell surface molecules on multiple myeloma cells. The attachment of antibodies to cancer cells makes it easier for the immune system to recognize and destroy the multiple myeloma cells. These drugs are much larger molecules and are much more expensive to manufacture than small molecule medicines. Because biologic therapeutics are proteins, these medicines typically must be administered via either injection or intravenously. IV administration requires an outpatient visit and adds to the expense of these drugs. As mentioned previously, effective treatment of multiple myeloma is a 2-step process. First, the cancers are brought under control with oral and intravenous chemotherapy, including dexamethasone, lenalidomide, or pomalidomide, and other medicines as needed. Second, the patient undergoes an autologous stem cell transplant, which eliminates cancerous blood cells and replenishes the immune system with healthy blood cells derived from healthy bone marrow. In general, it is best to carry out an autologous stem cell transplant as soon as possible after the patient's cancer has been stabilized with chemotherapy. Delaying the autologous stem cell transplant raises the risk that the multiple myeloma cells will become resistant to chemotherapy and the cancer will progress. Therefore, autologous stem cell transplant is normally a priority for multiple myeloma patients. It is the most effective treatment and the standard of care. However, treatment guidelines were dramatically altered during the COVID-19 pandemic to minimize the risk of infectious disease spread. Professional medical societies recommended that doctors extend drug therapy and delay stem cell transplant to avoid the long hospital stays associated with stem cell transplant. The European Society for Medical Oncology recommended that stem cell transplant be delayed and lenalidomide treatment be extended. The American Society of Hematology recommended delaying the stem cell transplant until the pandemic abated, and the International Myeloma Society recommended postponing the stem cell transplant. The pandemic obviously forced physicians to make challenging decisions in caring for cancer patients, and the choices involved difficult trade-offs. The first and most striking result of my research is shown on this slide. When I examined adverse event reports for multiple myeloma drugs, lenalidomide showed a sharp uptick during the pandemic. Lenalidomide adverse events had been on a generally increasing trend prior to the pandemic. However, lenalidomide showed a significant 61% jump in adverse events from 2020 to 2021, possibly due to the changes in treatment guidelines for multiple myeloma during the pandemic. As seen on the bar graph, there are roughly 30,000 adverse event reports for lenalidomide in 2020, followed by 50,000 adverse event reports for lenalidomide in 2021. Pomalidomide, a drug in the same class as lenalidomide, showed a 34% increase in adverse event reports from 2020 to 2021, coinciding with the COVID-19 pandemic. As seen on the bar graph, there are roughly 10,000 adverse event reports for pomalidomide in 2020, followed by 13,000 adverse event reports for pomalidomide in 2021. Dexamethasone is the oldest FDA-approved medicine in this study. Dexamethasone adverse events have shown an upward trend over 50 years of use, but there is a notable 27% increase in adverse events from 2020 to 2021. As seen on the bar graph, there are roughly 11,500 adverse event reports for dexamethasone in 2020, followed by almost 15,000 adverse event reports for dexamethasone in 2021. One possible question that can be raised when interpreting the adverse event data is whether or not the increase in adverse events for multiple myeloma drugs represent an overall increase in adverse event reporting. In other words, is the increase in adverse events specific to multiple myeloma drugs, or have individuals across the country simply been reporting adverse events more frequently for all drugs? To answer these questions, I compared the percent increase in dexamethasone adverse event reports to the percent increase in total adverse event reports for all medications in the FDA database. Over the past 20 years, increase in adverse events for dexamethasone has far outpaced the increase in adverse events for all drugs in the FDA adverse event reporting system database, particularly from 2020 to 2021 during the pandemic. Turning our attention to the biologic medicine daratumumab, adverse events for the drug were already on an upward trend prior to the pandemic, but adverse events associated with daratumumab accelerated during the pandemic. The biologic medicine showed a notable 36% increase in adverse events from 2020 to 2021. Similarly, while adverse events associated with the biologic medicine pembrolizumab were already on an upward trend prior to the pandemic, adverse events associated with this drug accelerated during the pandemic. Pembrolizumab showed a 26% increase in adverse events from 2020 to 2021. The biologic therapeutic rituximab showed a 9% increase in adverse events from 2020 to 2021, coinciding with the COVID-19 pandemic. Finally, the small molecule therapies, bortezomib, carfilzomib, and ixazomib, together showed an increase in adverse events during the pandemic as seen in this bar graph. The adverse events for these three drugs were pooled for analysis to account for patients switching between drugs in the same class. Adverse events attributed to the class of drugs composed of bortezomib, carfilzomib, and ixazomib rose 20% from 2020 to 2021. I also examined the most frequently reported reactions for each of the 9 multiple myeloma medications. This table shows the top 3 reported adverse event reactions for each medication in the FDA adverse event reporting system. The most frequent adverse events were not reactions to the medicines, but rather reflect progression of the underlying cancer. Prevalent adverse events across these medications include plasma cell myeloma, death, and malignant neoplasm progression. I was also interested in examining trends in the affordability of multiple myeloma chemotherapeutics. The number of 30-day prescription fills for each medicine, as well as the total cost per year for each medicine, were obtained for 2013 through 2020 from the Medicare Part D database from the Centers of Medicare and Medicaid Services. The cost of a 30-day fill was calculated by dividing the total cost by the number of 30-day fills for each medicine. As seen in this chart, the cost per 30-day fill for lenalidomide almost doubled from 2013 to 2020. At over $16,000 per 30-day fill, the cost of lenalidomide would easily overwhelm an uninsured patient. As seen in this chart, the cost per 30-day fill for pomalidomide increased by 69% from 2013 to 2020. At over $18,000 per 30-day fill, the cost of pomalidomide could also overwhelm an uninsured patient. Surprisingly, the cost per 30-day fill for dexamethasone rose by 43% from 2013 to 2020, which is unexpected given that the drug has been in clinical use for decades and became generic decades ago. In conclusion, reported adverse events from multiple myeloma drugs increased during the pandemic. Most notably, the oral chemotherapeutic lenalidomide showed a 61% increase in adverse events from 2020 to 2021. The most common adverse events reflected the progression of underlying cancer. These trends may have resulted from modifications to multiple myeloma treatment guidelines, which advocated for extended chemotherapy and delayed stem cell transplants during the pandemic. These results suggest a need to examine the effects of treatment guidelines on long-term patient outcomes for multiple myeloma in the future. The other main finding of my research is that the cost of prescriptions for multiple myeloma drugs has risen over time. The cost of lenalidomide 30-day prescription fill nearly doubled between 2013 and 2020 from $8,700 per fill to over $16,200 per fill. The cost of a pomalidomide 30-day prescription fill rose 69% between 2013 and 2020 from $10,800 per fill to over $18,200 per fill. The cost of a dexamethasone 30-day prescription fill rose 43% between 2013 and 2020. These results suggest a need for improved policies to regulate the cost of needed cancer medications, as it can greatly impact patients. Thank you for listening to my research presentation, and I hope you are able to learn a few more things about multiple myeloma treatments.